Have you ever heard someone say, Medicare Advantage plans are only good until you get sick? It is a comment that is tossed around a lot when it comes to Medicare discussions, and the implication is pretty clear. Choose a Medicare Advantage plan, and you could be setting yourself up for potential financial disaster the moment you develop serious health issues. But is this actually true?
Why wouldn't it be?
What happens when we look at the real numbers and do the math? You might be surprised to learn that even for people with significant health issues, Medicare Advantage plans can sometimes come out ahead financially in the long run. Does this mean that Medicare Advantage plans are obviously better than Medigap plans? Well, that is exactly what we will explore today. I'm Cameron Giardini from Giardini Medicare, and in this video, we are going to do a deep dive into the long-term cost comparisons between Medicare Advantage and Medigap plans. We will look at real numbers, real scenarios, and real projections to help you understand what these different plan options might cost in the long run. Now, before we jump in, we do have to be clear about something. We are only looking at the financial comparisons in this video. Medicare Advantage plans do have additional considerations like network restrictions, provider changes, and prior authorization requirements. We have talked about these downsides in other videos, and we will continue to do so in future videos. But today, we are focusing purely on the math. Math. In reality, choosing between Medicare Advantage and Medigap plans, it involves much more than just numbers on a spreadsheet, but understanding the financial side is still a very important piece of the puzzle. As a reminder, before we get into the numbers, make sure you scan the QR code that you can see here on the screen, and we will also have a link in the description for you to join our private Medicare Q&A Facebook group. There we can answer any specific Medicare questions that you might have. For this video, we are doing something a bit different. We are going to look at the long-term cost for Medicare Advantage and Medigap plans over a 21-year period. And why 21 years instead of 20? Well, why not? We'll show you 3 different real-life examples comparing Medicare Advantage plans against the Medigap Plan G, Plan N, and the High-Deductible G over that time frame. Each example will feature somebody with different healthcare needs. This will range from someone with average health, someone with high healthcare needs, and someone with maximum medical usage. When we talk about the long-term cost, we are including both the monthly premiums that you pay for the coverage, as well as the various out-of-pocket costs like copays and coinsurance, which will differ significantly between Medigap and Medicare Advantage coverage. Remember, these projections are to help show potential cost comparisons over time. They should not be the only factor in your decision-making process. You will, of course, want to consult an independent broker about your specific healthcare situation and budget to decide what is right for you. To choose the Medicare Advantage plans we used in this video, we used CMS enrollment data to find plans with some of the highest enrollment numbers in each market, and we did this to make sure that we're not just cherry picking the cheapest or most expensive options to shift the narrative one way or another. We focused on 3 states, Michigan, Florida, and Texas, to capture a range of markets. In Michigan, our home market, we looked at both HMO and PPO options to show different cost scenarios. On the screen, you can see the premiums and out-of-pocket cost for each of these plans in 2025. Now in Texas and Florida, we did the same thing by looking at both HMO plans and PPO plans with large enrollment numbers. As you can see here, the Medicare Advantage plans in Florida's market, they tend to offer lower out-of-pocket costs, especially with their HMO plans. Texas, on the other hand, is more in line with the overall costs and coverage that we see with plans in Michigan. Overall, it is impossible to do a deep dive into all these different Medicare Advantage markets in each state, but hopefully this gives you a good overall picture. Choosing which Medigap plans to highlight was more straightforward. We looked at the long-term costs for Medigap Plan N, Plan G, and the High-Deductible G. While there are other plan letters that exist, these 3 are by far the most popular plan options in 2025, and we don't see that changing for years to come. To determine the premiums for these plan letters in different states, we looked at specific cities' zip codes in each of these states. We then calculated the average of the 5 lowest cost Medigap plans for both females and males at age 65 in that zip code. Just know we did not take into account potential household discounts in these calculations. Of course, Medigap premiums will increase every year, so we need to account for that in our projections. Based on our internal tracking of dozens of Medigap premium increases across the country over several years, we found that Plan G increased by about 6.5% per year, Plan N at 4.5% per year, and the high deductible Plan G at 2.5% per year. When it comes to out-of-pocket costs, we also had to factor in the average yearly changes to Medicare deductibles, like the Part B deductible and even the Part A deductible for the high deductible Medigap plan. You can see these projected increases here on the screen now. In addition to a Medigap plan with its own monthly premiums, you will almost certainly need to also enroll in a standalone Part D plan to cover medications that Medigap plans don't. In 2025, Part D premiums range from about $0 per month all the way to triple digits, but the average enrollment weighted premium is $45 per month in 2025. For our examples, we assumed a $0 per month Part D premium for somebody who's relatively healthy and a $45 per month premium for those with more significant healthcare needs. Medicare Advantage costs, like Medigap costs, also change year over year, but their trajectories are not as predictable. For Medicare Advantage out-of-pocket costs, they will vary greatly by region and by plan. After reviewing historical trends of out-of-pocket costs that you can see here on the screen from 2019 to 2025 in Michigan, we estimated a 5% annual increase in Medicare Advantage out-of-pocket costs. So for example, if the total copays add up to about $1,000 in year one of our projections, we would then assume that these same costs would be $1,500 by year 10 in our projections. We also looked at the maximum out-of-pocket limit, also known as the MOOP, over time, and the official maximum out-of-pocket limits have risen by about 5.7% per year from $6,700 in 2019 to $9,350 in 2025. However, the median amounts that people actually pay for their maximum out-of-pocket limits has been more stable, with about a 1% per year annual increase, as you can see here over time. To be cautious and fair, we assumed a 2% annual increase for those that hit their full maximum out-of-pocket every year. And last but not least, if you're wondering how we chose to project Medicare Advantage premium growth, for years we have seen $0 premium plans being the go-to for Medicare Advantage, and our assumption, frankly, is that this will continue for years to come, so we assume a $0 per month premium in our projections. Before we look at the cost projections, there is something important you need to remember.
Would you just hurry up?
No, really, it's important. In most circumstances, changing from a Medicare Advantage plan to a Medigap plan requires you to answer health questions and go through medical underwriting. You'll have to qualify in that case for a Medigap plan based on your current health and pre-existing conditions, and being approved for a new Medigap plan is not guaranteed. This means it is not as simple as choosing a Medicare Advantage plan when you have limited health needs and then simply switching to a Medigap plan if your health worsens. That strategy won't work if you develop health conditions that make you uninsurable under the various Medigap plans underwriting guidelines. Also, we are only considering medical out-of-pocket costs in this video, and not prescription out-of-pocket costs or potential extra benefits with Medicare Advantage plans. Those factors will vary far too greatly and are impossible to predict and project over time. Everyone gets different value from the additional benefits provided by Medicare Advantage plans. However, according to MedPAC, the average enrollee in a conventional Medicare Advantage plan has $2,142 worth of extra benefits available to them in their plan year. Lastly, Part B premiums are not factored into these comparisons either. Whether you choose Medigap or Medicare Advantage, you are still responsible for paying your monthly Part B premium, which in 2025 is $185 per month for the base premium. Although some Medicare Advantage plans may provide a reduction to this Part B premium, we did not include those plans in our calculations. As a disclaimer, these are just projections used for educational purposes, and you should not use these numbers to make your final Medicare coverage decisions. As always, consult with a broker. Our first example compares the possible long-term costs of a Medicare Advantage versus Medigap plan for Debbie. We consider Debbie to be an average health. This doesn't mean she never goes to the doctor or hospital, but she also is not going to go multiple times per month. You can see the frequency of Debbie's specific healthcare visits here on the screen. Also, more importantly, you can see the yearly cost she would likely expect to pay for the different treatments and procedures during the years when she has relatively few healthcare needs with both the HMO and PPO Medicare Advantage plans in Michigan. As well as you can also see what she might expect to pay with a Medigap Plan G and Plan N in those exact situations. On the other hand, here is the same comparison of these different plan options for Debbie, but this time during the years where she has more healthcare needs. Unsurprisingly, the Medicare Advantage costs are much lower when she has fewer healthcare needs, and then are often higher when she has more healthcare issues arise. Also, the HMO plans typically have lower out-of-pocket costs compared directly to the PPO plans. First, let's look at the long-term Medicare Advantage projections for various plans for Debbie in Michigan. Although the costs over time are relatively similar, you can see that unsurprisingly, again, the plans with the lowest projected cost are the HMO plans. Keep in mind that these graphs, they do show the cumulative costs over time, with each year's cost adding to the previous years. When we add the Medigap projections for Debbie, you'll see that in this situation, the cumulative cost projections are lower for her Medicare Advantage options compared to Medigap. Now, if Debbie were to instead live in San Antonio, Texas, you can see her possible cost projections comparing Medicare Advantage and Medigap here on the screen. Make sure to pause the video here if you do want to look at it more in detail, and just so you can see even more, here is this data in table format as well. Lastly, if she were living in Tampa, Florida, here are her long-term projected costs between Medicare Advantage and Medigap options. Regardless of where she lives in these scenarios, based on her healthcare needs over the years, each market shows out-of-pocket medical costs being lower with Medicare Advantage than Medigap, and with some of the HMO plans in Florida having especially low projected costs. But this really isn't that surprising given what we know about being healthy with Medicare Advantage.
Come on, pal, tell me something I don't know.
So what if we look at somebody else instead who requires substantially more healthcare needs over their lifetime while on Medicare? For this, we will use Steve. Steve is very healthy in his first year on Medicare, so he enrolls in a Medicare Advantage plan. But then, starting year 2 onward, he goes to the doctor much more often and has many more services throughout the year compared to Debbie. And again, you can see what his cost might look like in 2025 if he lives in Tampa, Florida, with the various options like the HMO or PPO Medicare Advantage plans, and again, compared to the Medigap Plan G and Plan N. Perhaps surprisingly, in this specific market, despite having many healthcare needs during the year, his overall costs may still be lower with a Medicare Advantage plan. But what about long-term? When we look at the long-term projections for Steve's cost in the Tampa, Florida market, you can see that due to the uniquely low out-of-pocket cost for some of the Medicare Advantage plans in this part of the country, even with 20 plus years of serious healthcare needs, some of the HMO plans clearly still have lower estimated total costs compared to Medigap plans, even the high-deductible Plan G. However, some PPO plans are in line or higher than the Medigap options. You can also see this in the chart format if you would like to pause it. Now, if Steve lived in San Antonio instead, the results become a bit closer. In this case, we see a couple of HMO Medicare Advantage plans still have lower overall projections even compared to the Medigap plans, including Plan N. However, many of the PPOs are on the opposite end of the spectrum and have the highest estimated cost of all the plan options. Lastly, in Michigan, Steve's projections with the PPO plans are fairly in line with what we saw in Texas, but now the HMO plans also have much higher overall projections. In fact, in the specific Michigan market that we looked at, the HMO plans have higher long-term projections than all of the Medigap options. Again, this is just the math. This is not considering factors like prior authorization, network restrictions, or plan changes. We are simply looking at the financial comparison between the two options. We know there is more to the decision, but hopefully these realistic examples show how Medicare Advantage and Medigap costs might actually compare instead of just trying to give a blanket, ominous statement like good luck when you get sick.
That sounds ominous.
Now, for those of you wondering, what about the more catastrophic, worst case scenario? Let's finish and look at John. John rarely goes to the doctor during his first year on Medicare, but in year 2, he receives a surprising diagnosis that he has end-stage renal disease and will need dialysis and many treatments for years to come. In this case, our projections for John, they will consider what happens if someone has to pay their full Medicare Advantage maximum out-of-pocket limit each year. Let's look at John's estimated out-of-pocket cost over time for these plan options in Michigan. Unsurprisingly, we see that all of the Medigap options have lower projected costs compared to Medicare Advantage options, with the high-deductible Plan G being the closest to the Medicare Advantage plans, and with Plan N having almost half of the estimated long-term cost as many of the Medicare Advantage plans. If John were to live in the Texas market instead, we still see that Plan N and Plan G have projections that are the lowest overall, but now there are HMO Medicare Advantage plans that are a bit closer to the Plan G and are actually lower than the high-deductible G. However, the PPO costs, they still remain high overall. Lastly, if we look at our final example in Tampa, we see a very different trend compared to the other 2 markets, as you might expect by now. In this case, even with the worst case projections for John reaching his maximum out-of-pocket limit every year, there are still HMO plans that have long-term estimated costs lower than the 3 Medigap options. However, as you can also see, this is heavily dependent on the Medicare Advantage plan and whether it has a low maximum out-of-pocket limit compared to other plans on the market. There are still Medicare Advantage plans in this case with estimates close to double that of Medigap options. Since we showed a lot of charts and data in this video, we will link to our spreadsheet with all of this data and cost projections in the description below.
No more math! No more math!
So if you made it this far, thanks for sticking with us, and please don't forget to give this video a like. Again, the point of this video was not to show whether Medicare Advantage or Medigap plans are better in the long run. Instead, we wanted to answer the question of what it actually looks like long-term when comparing people with various healthcare needs using Medicare Advantage and Medigap plans in a couple different markets across the country. Overall, while looking at specific numbers and possible cost comparisons can be helpful, fundamentally, the choice between Medicare Advantage and Medigap will come down to what you are willing to spend and the risks that you are willing to take. Spreadsheets, they don't show network restrictions, they don't show prior authorizations, and more that you face with Medicare Advantage plans. At the same time, it is almost impossible to quantify the monetary value of the extra benefits you might receive with Medicare Advantage plans. Make sure to take all of these additional factors into account. Remember, it is not as simple as saying if you're healthy, choose Medicare Advantage, and if you're not, choose Medigap. Also, you probably notice when looking at all of these cost projections that where you live will have a drastic impact on your Medigap and Medicare Advantage options. So please make sure you watch this video about that topic next.